Starting to come through the door. Come through the door.
Good afternoon and welcome.
We're so excited to have Dr. Eunice Peterson back with us today for their part 2 of Black Mental Health Matters. And we're so excited. We have over 2,000 registered for the event. And they're starting to come through the door. We're at 1:45. What you're all seeing on your screen are the upcoming speakers and information about when they're going to be here and what they're going to talk to us about. Well, I agree. The last one was very phenomenal. There's a question here for Dr. Peterson of what years were you in Johns Hopkins Hospital? Now, Dr. Peterson is muted, but I think I read her lips, and I think she said I wasn't.
That's correct. I wasn't.
Oh, Diana has shared part 1 with all of her family. I'm particularly interested in today's talk and hearing more about microaggressions. One of the things was in conversation with somebody with earlier today was how we don't read each other's face anymore because we're wearing a mask. And I think that a lot of people that I know or come in contact with, I've gotten to the point where I read their eyes, and it's obvious to me how they're feeling, whether they're happy or frustrated or whatever. And I'm usually right. And so I think that we all do have a lot to say with our eyes too. So I'm interested in hearing what Dr. Peterson has to share with us. Yes, Madeline, everyone is automatically muted when they come in. This is a webinar version of Zoom. And so you're all muted so that the speaker will be in charge. And there may be an opportunity later to unmute, but right now everybody is muted.
And additionally, all your cameras are off.
Oh yeah, that's right. Cameras are off too. So where are y'all coming from? I know between the 5 of us, we're in the Philadelphia area, the Harrisburg area, Philly, Schuylkill, Norristown, Columbus. Wow, it's going so fast I can't even read them all. Allentown, Reading, Gettysburg, Harrisburg, Pittsburgh, Connecticut, Altoona, Washington, PA, California, Georgia, Anybody from outside the country? St. Louis, Bucks County, Asheville, North Carolina. Oh, I love Asheville. Maryland, Erie, Community Mental Health in Philadelphia, Scranton, Beaver County, Chambersburg, Hampton, Virginia, Indianapolis, Carbondale, Virginia Beach, Seattle, Washington, Austin, Texas. Oh, I hope you all are doing well. Children and Youth in York, PA, Modesto in California. Ooh, Glen Mills, Dallas, Texas. I'll just mention it again in case anybody is wondering. Everybody's camera and sound has been muted as this is webinar software. So don't be concerned if your camera's not showing you or you can't speak. It's part of the software. Well, we're going to be beginning in a few minutes now. Does anyone else have anything to say before we get started? Seems like I'm the only one talking.
I will say if there, I know we have a couple people already on YouTube. We do have open seats in the Zoom room. If you're on YouTube, it'll probably fill up relatively quickly, but that is an opportunity right now.
Nancy, something that you'll probably find funny is that someone referred to you as Dr. Massey on YouTube.
Oh, that is funny.
Get a kick out of that one.
Yeah. Mark, there's a question here about a call-in number.
The call-in number would be on your reminder email. Or should be on your reminder email with the username and password for it. Let me just double check. Yep, it'll be on the reminder email. There's a variety of numbers that are there. I will say, I think once the Zoom room fills up to 1,000, the call-in numbers might not work at that time. You have to call in before it gets to the 1,000, and we're about 720 right now. And that email went out, looks like about 128 today.
Thank you, Mark.
Nancy, is it possible for you to post the link for future PA Cares webinar series talks in the chat box?
I just did.
Awesome, thank you.
Thank you, James.
All right. So we are right at about 2:30, and I know that we have a great presentation today. Today's session is being recorded. My name is Mark Durgan. I am the project director for the Pennsylvania Care Partnership, and I wanted to welcome everyone to today's webinar and the webinar speaker series provided by the PA Care Partnership in association with the Office of Mental Health and Substance Abuse Services. Information will be available at the end of today's presentations for those that are seeking continuing education credits for this webinar or for a certificate of attendance. This information is also available in the email that you received today at about 1:28 from PA Care Partnership, info at pacarepartnership.org, or it's also sometimes comes in as no reply at zoom.us. We have over 2,000 people registered for today, with some watching on YouTube as the Zoom room gets filled. During the presentation, if you have any questions, please type them into the Q&A option in Zoom or the comment section in YouTube. We will get to as many of the questions as we can during the presentation. Our moderators today are Nancy Massey and Jamal Ford, and we will be they will be monitoring the chat, Q&A, and YouTube comments for questions. It is now my pleasure to welcome Dr. James Peterson, who will be introducing our presenter. Dr. Peterson is a writer, educational consultant, and content creator. He's a graduate of Duke University and the University of Pennsylvania. He is also the founder of Hip Hop Scholars, Inc., an association with hip hop generational scholars dedicated to researching and developing the culture and education potential of hip hop, urban, and youth cultures. Dr. Peterson, welcome.
Thank you, Mark, and thank you to everybody for joining us today. And Dr. Eunice Peterson, I just want to thank everyone for the response to part one of this this presentation series. We really do appreciate the engagement. Dr. Peterson is a board certified adult and child and adolescent psychiatrist who is a proud graduate of Meharry Medical College in Nashville, Tennessee. She completed her psychiatry residency as well as her child and adolescent psychiatry fellowship with the University of Maryland at the Shepherd Pratt program. She is currently an associate professor with the University of Texas Southwestern Medical Center and the lead consultant for Onyx Psychiatry and Wellness Practice. Dr. Peterson has an abiding interest in advocacy, psychoeducation, elimination of healthcare disparities, eradication of mental health stigma, and a promotion of mental health wellness. And before I turn it over to my sister here, I just want to say, in part one, one of the participants asked a question about, what kind of toll it takes on a person, on a physician, on a healthcare provider to do this kind of work that looks so closely and so critically at healthcare disparities. And what we're going to see today is Dr. Peterson sharing with you over a decade of her own sort of research and experiences wrestling with these disparities, especially as they relate to microtraumas and microaggressions. And I can tell you as a witness for my sister, it takes its toll. It's difficult work. Aside from the difficulty in terms of the skill set required to be a psychiatrist, it takes its own emotional and cognitive and mental toll on folks who pay really close attention to it. And so some of the information that's going to be shared here today won't be unfamiliar to you, but it will move you, and some of it will be devastating to look at the data in the ways that Dr. Peterson does. And so I just wanted to sort of shout out that person who asked that question, like, what happens to caregivers who are engaged in this kind of work like my sister, and what kind of toll it takes, and say it does take a toll. But Dr. Eunice Peterson is strong. And as always, I'm honored to be on the DIAS with her, and I want to pass along the presentation. Dr. Peterson, take it away.
You are on mute.
You're on mute. You're on mute, Dr. Peterson. You're on mute.
I'm excited to get started. So what I was saying is thank you so much for that lovely introduction. And I would like to share my gratitude to the PA Cares Partnership, particularly Jamal and Nancy and Mark, as well as you, Dr. Peterson, for creating this opportunity for us to share information that I think is important for us to become better as practitioners and better as community members. So as was mentioned, we are going to be talking about microtrauma and microaggressions. This is the second part of a two-part series where we really explore the effect of race on Black mental health and also on Black physical health. So I'm going to, I have no disclosures to share, and I'm going to review some of the key points of the previous presentation, and then we're going to define microaggressions and microtrauma. We're going to talk about the role of police violence on the mental health of Black Americans, and we're going to try to talk about some of the pathways that providers can take to try to remedy the harms from racism. This again, this bluff statement is my homage to those who are in the military. It's bottom line up front. So another way of saying that is take away points. If you learn anything from this presentation, I hope that you will learn that racism kills, and there is an increasing body of research to support that, which we'll talk a little bit about later. And then just to gain a greater appreciation for the fact that perceived discrimination, microaggressions, and publicized police brutality on African Americans contribute to poor health outcomes in the African American community. I would also, for this presentation, like to offer a disclaimer, which I didn't do last time, but I appreciate one of the viewers letting me know that it might be appropriate to sort of share the fact that we're going to be discussing difficult topics, whether it's in the chat room or something that I say, the content of the slides or the videos that are included. It's a difficult topic that we're discussing, and it could be triggering for some people. So definitely want to encourage people to be mindful of that. So the approach remains the same for those who are joining us from the first part of this series. We have to be able to talk about things if we're ever going to be able to change. So the approach is to talk about it, then we should think about it, then we should take action with the goal of transforming or improving or making things better. I'd like to make sure that we have some shared understanding of some of the topics that I'm going to be discussing and what our overall goal is. And that is for us to be able to have equitable access to mental health care and for people to achieve the highest level possible of mental health. I have favored definitions for mental health as well as other topics, and this is one that I'm sharing with you. That is according to the World Health Organization, I believe it came out in 2014, and it says that mental health is a state of well-being where everyone is able to realize their potential, they're able to work fruitfully and productively and to contribute to their community while being able to deal with normal stresses. again, wanting to make sure that we're on the same page, it is known and research supports that African Americans receive poor quality care. They have greater psychological distress. They are disproportionately burdened with mental illness. They're less likely to receive mental health care. And the disparity for Black Americans remains even when you correct for income and physical comorbidity. So the APA has identified stigma as the primary barrier for African Americans in terms of accessing mental health care. But what we submit today is that racism and discrimination actually play significant roles that are at least as much a culprit, if not greater culprits, in preventing African Americans from feeling comfortable and confident with accessing mental health care. I refer to stigma as a blanket because I think that it covers everything. So there are different types of stigma, and this is just a reminder of structural stigma. Structural stigma represents institutional policies or societal structures that actually result in decreased opportunities for those who suffer from mental illness. As I have a favorite definition for mental health, I also have a preferred definition for racism. And this definition is provided by Dr. Jones. And I would bring your attention to the first, or rather the second two bullets. So what I've come to learn is the importance of the dynamism of the definition of racism. So I think I have been more aware of the fact that racism connotes disadvantages to one group, but it is also important to know that racism conveys advantages to another. And in America, I'm talking about the disadvantaged people being people of color or Black Americans, and the advantaged people being white people. And if we cannot understand the dynamism of racism, then I don't think that we'll be able to equip ourselves with the tools that we need in order to overcome it. Racism is really just the tip of the iceberg. So we're going to delve a little bit deeper by talking about microaggressions, by talking about perceived discrimination, by talking about the impact of publicized police brutality on African American health. Again, I want to briefly review that there are several different categories for or types of racism, and there's a parallel between structural and internalized stigma, structural and internalized racism. And it's important to remember that parallel because we're going to build upon the parallels that are involved in the pathways to racism, if you will. So structural racism is really tries to capture the fact that racism has a cumulative effect in that, you know, there are policies and practices that actually support the disadvantages and disenfranchisement of the disadvantaged group. I included this slide because I wanted to be able to share with you all a result of structural racism and sexism. So remember how I said there's sort of layers that's built upon historically that offer advantages to white people and disadvantages to Black people? That results in numbers like this. So we know that racism, and there's quite a growing body of research that shows that racism offers significant detriment to the physical and the mental health of African Americans. And there is a psychobiological process that actually is able to explain that impact. So racism can actually increase the risk of things like post-traumatic stress disorder, can increase the risk of symptoms of obsessive compulsive disorder, can increase the risk of binge drinking or substance use, disordered eating behaviors, anxiety, depression, overall psychological stress, and physiological distress that ends up increasing the morbidity and ultimately the mortality of certain conditions within the African American community. I would like to share with you my version of true or false. This is, I'll say, a pop quiz. And for those of you who were able to join us the first time around, please do know that this is not exactly the question that was asked before. So if you feel so led, this is entirely voluntary, please do select whether you feel like this is fact or fiction. And those who have selected fact would be correct. So perceived discrimination has been shown to contribute to mental health disorders among BIPOC, which includes African Americans. So I'm not able to advance the slide, but we're going to continue. Perceived discrimination is something that causes there to be significant problems in both health, physical health and mental health. And it also is something that we can explain biologically. So when people experience perceived discrimination, and really perceived discrimination is just someone's anticipation of discrimination. So it's not actual discrimination, it's the anticipation of discrimination. And we now have a growing body of research that actually shows that that anticipation also leads to significant disturbances of physical and mental health in African American people. Next slide, please. So we know that perceived discrimination actually changes our behavior. So it increases our stress level, but it actually will lead to people participating in unhealthy behaviors and avoiding participating in healthy behaviors. And that dynamic actually contributes to the increased morbidity and mortality of conditions like cancer, like diabetes, like high blood pressure, like obesity, like asthma in the African American community. Next slide, please. So let's talk a little bit about the biological process. So when someone experiences stress, it sets off a chain reaction. Our human body is developed to be able to prioritize a response to a stressor. And it will release certain hormones, it will redistribute blood in certain parts of our bodies that we're better able to accommodate an acute or a sudden stressor. We call that the fight or the flight response. But what happens if it's not acute, if it's not something that's over with after a discrete period of time? What if the stressor is recurrent or chronic? It never actually goes fully away. Well, our bodies were not necessarily developed to deal with that well. We want to be able to achieve something called homeostasis or balance within our system. And so what studies have shown is that when people are chronically stressed and things like perceived discrimination, racism, discrimination, and microaggressions occur, they can cause chronic stressors because they are intertwined into our society, the fabric of our society. And they're a consequence of structural and societal entities that contribute to stressful environments. So if the stress is chronic, then the body is not ever able to reset back to a lower stress level. And so what happens is that higher stress level causes hormones that are pro-inflammatory to be at a higher level than they would be if we were not at a higher stress level. And that higher degree of inflammation can actually do things like decrease our immune response and contribute to our vulnerabilities of more severe symptoms of various conditions that were mentioned on the previous slide. There's also been some epigenetic studies that suggest that when people are born, there's a marker in a cell called a telomere, which basically indicates the length of life of the cell, which we correlate to the length of life of a person. And when African Americans are born, some studies suggest they have longer telomeres, but that's not fully substantiated, but they have telomeres that, let's say, are the approximate length of white people when they're born. But over time, the telomeres of African Americans actually shorten, and it's believed to be related to the chronic stressors of racism, such that African Americans have a shorter lifespan. So we have, I think, insufficient, but a growing body of evidence that's helping us to link some of the impact of racism, perceived discrimination, and microaggressions on the health, physically and mentally, of African Americans. Next slide, please. We also know that the greater degree of, or the more frequent the perceived discrimination, the greater degree or the more negative mental health outcome for African Americans. Next slide, please. Fact or fiction? So I would be curious to know why people are choosing one answer or the other, and maybe that can be a discussion that will go on in the chat. But if you chose fiction, you were correct, and that's because it's more than that. So there was a study that was conducted of 187 African-American female undergraduates, and they were evaluated for their experiences of macroaggressions, so overt incidences of racism, and microaggressions. And what the study found was that in any 1 year, the African-American females reported experiencing 96%. So 96% of the African-American females reported experiencing microaggressions at least a few times a year. And approximately 63% of the African-American females reported experiencing macro aggressive episodes over the course of the year. And they were able to find that there was a higher association of increased anxiety from the macroaggressions versus the microaggressions. But just imagine, college is challenging in and of itself, and to have to bear the burden of microaggressions, which we will discuss in more detail, really is a disadvantage in and of itself. Next slide, please. So this is my definition for microtrauma. I describe or characterize a microtrauma as an unconscious or conscious response to a microaggression. So it's a mediated emotional response to either a perceived or actual adverse event. Next slide, please. Microaggression was a term that was coined by the wonderful Dr. Chester Pierce, and it was established in 1970 to try to capture his observations of the insults that African Americans were experiencing by non-African Americans. So the original use of the term was really to reflect the everyday experiences of Black Americans. Next slide, please. So Dr. Sue actually expanded this definition for microaggression to include it to all marginalized groups. So macroaggression has a broader application these days. Next slide, please. So I want to make sure that again, we're on the same page, or that we have a shared understanding of the terms that we're using, why we're using them, and how we're using them. So when we say microaggression, micro does not reflect the scale of the impact. It really is describing the mechanism of action. So I don't want people to have a takeaway that microaggression means that there's something small going on when we're talking about this process. So Dr. Sue and his team established there's two primary categories of microaggression. There are, which are environmental and interpersonal. Next slide, please. So environmental is similar to structural racism and structural stigma in that it is a reflection of the systemic manifestation of racism. So an example of an environmental microaggression might be someone who goes to a university, attends a university, and all of the buildings on campus are named after white heterosexual males. Or it might be an example of there only being one person of color on the board of a corporation. Or it might be something like there being a #1 rated television show about friends in an urban area on TV for years, and there's not consistently a person of color. So those types of microaggressions are considered environmental and certainly do have a deleterious effect on how people perceive themselves. One of the challenges of microaggressions is that because there's not always intention involved with microaggressions, it sometimes incapacitates the person who is bearing the burden of the microaggression. And so it's important to recognize that lack of intention does not equal innocence. It does not equal a lack of the need for personal accountability in what we say and what we do. Next slide, please. So we talked about environmental microaggressions. Let's discuss in a little bit more detail the 3 different types of interpersonal microaggressions. Let's fill in the blank. Is this a micro insult, a micro discrimination, a micro invalidation, or a micro assault? So if you chose micro assault, you're correct. So a micro assault is a conscious and intentional discriminatory act. And an example of a micro assault might be something like using racial epithets, or it might be something like placing a porch monkey on your lawn. Next slide, please. Okay, so if you feel so led, please do fill in the blank. Is this a micro insult, a micro discrimination, a micro invalidation, or a micro assault? So if you selected micro insult, then you were correct. So a micro insult is a verbal or nonverbal form of communication that specifically conveys a disrespect for someone's racial heritage or identity. So an example of a micro insult might be a coworker asking a fellow employee how it is that they were able to get their job, with the message being that they weren't qualified, so they must have had some type of extra assistance or forgiveness in order to be able to have a job. Or it might be something such as someone waving a Confederate flag, or the Confederate statues that are sometimes along highways or within places like the community post office. Next slide, please. And finally, please do fill in the blank. Is this a micro insult, micro discrimination, micro invalidation, or micro assault? So if you selected micro invalidation, you were correct. So micro invalidation is a form of communication that particularly tries to exclude or negate the experiential reality of a person of color. So that is something like a person asking someone if where they're from, or even someone saying all lives matter versus Black Lives Matter. And we'll talk a little bit more in detail about the challenge of that perception. Next slide, please. Dr. Sue and his team established that there were, I believe, 9 categories for microaggressions, and there are some things that are related to these categories, and we're not going to discuss all of them, but I think that a few do bear talking about, or at least we should talk about some examples so that, again, we have a shared understanding of microaggressions and their impact. So criminality is the idea that I'm going, as a person of color, I'm going to refer specifically to Black people, that Black people are dangerous, that Black people are threatening just by their very existence. And so an example of a microaggression with a criminality theme is a white person who genuinely doesn't feel comfortable going into an elevator where there's a Black person and there's no one else. Or I think people are quite familiar with this experience of people saying that if they're walking down the street and they're on the same side of the street as a white person is on the same side of the street as a Black person, they might cross the street so they don't have to share the sidewalk. Or it is the commonly known incident where they remark that women might move their purse to the opposite side of their body if they're walking past a Black person. But I really want to emphasize to you that it is not just women moving their purses, men move their briefcases as well. This is not a gender issue. So there is this perception of criminality that leads to microaggressions against Black people. And the sad reality is that that perception of criminality leads to, I believe, the police brutality that Black Americans experience. So meritocracy is this idea that everybody has equal opportunity in America. So the flip side of that is that if you're not as successful as the majority race, then it's because you're lazy, you're not as qualified, you're not as capable. And that might come across in comments made such as affirmative action is racist, or it might be something that seems to be benign, like America is the land of opportunity. So second-class citizenship is the idea that there is a hierarchy in society where there's more than one level, and one level doesn't deserve or have the right to the same privileges as another in the same society. So an example of that might be so I was reading an article about how African-American business executives experience microaggressions. And one of them remarked that they were in this meeting and she was the only person of color. And one of the women asked her, a white woman asked her to get her a cup of coffee as if she were, I'll say, a servant. So she did get the woman a cup of coffee, but explained to her that she's also an executive. Another example might be that a white person and a Black person are standing waiting for a cab, and the cab will stop for the white person, but not the Black person. Again, just not having equal access. And then with the universality of the Black experience, because of structural racism, systemic racism, environmental microaggressions, there are limited opportunities for people of color, Black people, to be able to succeed. So there are still many areas in which we are the only or one of the few in terms of accomplishments and achievements. And so when we are the only or when Black people are one of the few, there is this expectation that that person is the spokesperson for the African American race, as if Black Americans are monolithic, and we're not. And that degree of responsibility can increase one's stress load tremendously. Next slide, please. So there are growing studies that are also showing that microaggressions are contributing to poor physical and mental health in African Americans. There are consequences for microaggressions, even though it seems as if they are slight. Remember, there's this sort of belief that micro means small, but again, I submit to you that it's not small. Micro refers to the mechanism of action, not the scale of impact. And so research shows that microaggressions create toxic environments. Microaggressions actually perpetuate and promote racism and stereotypes. Microaggressions cause physical and mental health problems, as I previously stated, and it can also contribute to systemic racism, whether it's a problem with deficits in education, deficits of access or opportunity to achieve in education, healthcare, our judicial system, or employment. So sometimes when people are suffering from microaggressions, they tend to feel invisible, right? So a Black person in a position of power may sometimes be required to over-validate their authority or substantiate their position when they are overlooked as if they're not qualified to be where they are. They might feel powerless. And again, there's that expectation that if there are only a few people who are available in a particular institution or setting, that they are representative of the race. All of these types of stress are chronic, they're toxic, and they can increase depression, anxiety, psychological stress burdens. They can increase the likelihood of physical health complications, including asthma, obesity, hypertension, substance use, and again, the avoidance of healthy behaviors and the increase of participation in unhealthy behaviors. Next slide, please. So I would like for us to watch this video, which I think does a really good job of translating microaggressions for us.
For people who still don't think that microaggressions are a problem,
Oh, you're so well spoken.
just imagine, instead of being a stupid comment, a microaggression is a mosquito bite.
Ugh, it's a compliment.
Mosquito bites and their itch are one of nature's most annoying features. But if you're only bitten every once in a while,
No, where are you really from?
Cleveland?
sure, it's annoying, but it's not that big a deal. The problem is that some people get bitten by mosquitoes a lot more than other people. I mean, a lot more. Whether it's on a date,
Oh, your English is so good.
Excuse me?
going grocery shopping,
You know, everything happens for a reason.
I'm just buying apples.
commuting to work,
So when are you gonna have a baby?
watching TV,
We have to keep the Redskins name. It's part of our culture and history.
or just walking down the street with your partner.
I couldn't even tell you were gay.
Mosquitoes seem to pop up everywhere.
Do you know John? Give me shopping advice. I love shared.
Of course, beyond just being annoying, some mosquitoes carry truly threatening diseases that can mess up your life for years.
Astrophysics? Maybe you should try less challenging, Major.
Ow, my dreams.
And other mosquitoes carry strains that can even kill you.
It looked like he was up to trouble, okay? I felt threatened.
So next time you think someone's overreacting, just remember, some people experience mosquito bites all the time.
You're all so exotic. Wow.
And by mosquito bites, we mean microaggressions.
So
People who
I will share with you that this is the sanitized version of the microaggression video. and it's also slightly less humorous because it's sanitized, but I don't think that it was appropriate for a professional presentation to share it, but I want to encourage you to try to find the full video, which is only, I think, less than a minute longer. This is, again, the videos that I include in this presentation, they're not new. And what I will ask is that if you have seen the videos before, that you see them again and look for what else it is that you can learn, because learning is an ongoing process. And so our task is to do our best to not be mosquitoes, and to recognize, again, microaggressions are not benign. They're not minimal. You know, if you really listen to what the mosquito said to that young person who wanted to pursue a career in astrophysics and they were dissuaded, it can be life altering. And so I want to encourage you to be mindful that microaggressions don't have a micro impact. So fact or fiction? Fact or fiction? I want us to start. So that youth was dissuaded. We're now going to sort of try to understand a little bit about where the awareness or the level of wokeness, if you will, of youth, before we talk about the impact of police brutality on Black youth in America. So if you feel so led, fact or fiction? So if you said fact, that it was true, that would be correct. So next slide, please. Newsweek did a study back in 1966, where they wanted to sort of get an idea of what teens were experiencing. This was a very, it was an explosive time in American history, really. And so they conducted a poll of more than 2,000 teenagers between the ages of 13 to 17 over nationwide. And they came back with some interesting information. And they decided to repeat the survey 50 years later. So what we know is that 44% of American teens thought that racial discrimination would be a problem back in 1966, but it's almost doubled. It almost doubled in 2016, 50 years later. Next slide, please. Fact or fiction? So if you said fact, that's correct. So the survey showed that African American teenagers are more aware of gun violence and fatal shootings of innocent people by police than white or Latinx teens are. They're also more likely to worry that they themselves might be victims of police shootings. Sad fact. Next slide, please. Fact or fiction? So if you chose fact, that would be correct. Black teens in America are more likely to worry that they will be shot. And I submit to you that it's not just at school, not just by police, and not just in places of worship, but even in their homes, given some of the recent events over the last few years. Next slide, please. So also, according to this poll, the sad fact is that there's been a 33% increase in the belief by Black teens that discrimination will never go away. Next slide, please. So this study by Newsweek showed that regardless of race or ethnicity, American teens believe that Black Americans are more likely to be discriminated against than others, particularly in how they're treated by the police or in their ability to access equitable employment. Next slide, please. So here's where research starts to help us understand a little bit more about the role of racism and police brutality on African-American health. So there were a group of public health scholars and social scientists, medical professionals who were exploring the relationship between police brutality and African-American health. And what they found was that there were 5 pathways that were linked as listed. And if you read what's on the slide, then you will see that there are events that are going to affect us on an individual and a community level that will increase stress potentially for an indefinite period of time, and again, tie into physiological responses that increase the morbidity and I submit also the mortality of African Americans, specifically because of racism. Next slide, please. So Dr. Marva Robinson, who was the former president of the St. Louis Association of Black Psychologists, did a study within 3 months around the time of the shooting death of Michael Brown. And what she was able to determine is that 34% of the community and 14% of police officers met criteria for PTSD. And I included this specifically not only to segue into the association between police brutality and Black Lives Matter, but because we don't have enough research around this phenomenon. We have a sentinel study, but we need more research to understand how it is that we are impacted when we're not directly involved or affected by the event that often takes on more than local prominence, but national prominence. Next slide, please. So this is an abbreviated list of African Americans who have lost their lives due to police brutality. If there is an asterisk by the name, these people had known mental illness. Dontre Hamilton, Eric Garner, John Crawford III, Michael Brown Jr., Ezell Ford, Dante Parker, Tanisha Anderson, Akai Guri, Tamir Rice, Romaine Brisbane, Jerame Reed, Tony Robinson, Philip White, Eric Harris, Walter Scott, Freddie Gray, Sandra Bland, Jamar Clark, Alton Sterling, Philando Castillo, Jordan Edwards, Stephon Clark, Breonna Taylor, George Floyd, Rayshard Brooks. And if you feel so led, perhaps there's a name that you're aware of that you can add to this list, because there's so many that are not included. Next slide, please. So let's hear from a child's perspective the impact of police brutality on Black people.
George Floyd was a father and a husband that lost his life just because of the color of his skin.
It wasn't an accident, it was racism. George is changing the world, and me and many other people, millions, are unhappy with this.
When I go on my social media or go on the news, mostly every single week a Black person is killed. Sometimes just for no good reason. Because I'm Black too, I keep on saying to myself, am I next?
If we're in the wrong place at the wrong time, we are dead because our skin is the reason we're guilty. I have been treated with racism all my life. older adults would look at me up and down when their children would try to play with me. They'd be like, no, honey, we don't associate ourselves with those kind of people. Go play with other kids over there.
Black people are being mistreated because they look quote unquote different from everyone else. This injustice needs to stop and we need to stand up. No one should be treated differently by their skin color. And police are supposed to protect and help everyone.
It's not fair, it's injustice. And it needs to stop now.
People are protesting about Black lives or saying no lives matter until Black lives matter.
Please sign a petition, protest, or even just post something on social media so you can stop hate.
Never judge someone by their skin color. We are all one race, and the race is called human race. Black lives matter.
Black lives matter.
Black lives matter.
Black lives matter.
Black lives matter. Period. Next slide, please. So fact or fiction? From 2013 to 2020, only 32% of police killings have resulted in officers being charged with a crime. Fact or fiction? So if you said fiction or fact, I'd be interested in you sharing on the chat why it is that you chose the answer that you chose. This is fiction. So in fact, that number is less than 2%. Next slide, please. So let's talk a little bit about the numbers. These numbers lie. And they lie because we don't have one federal agency that's responsible for tracking and or reporting the deaths of people while in police custody. And so there are agencies that are there, several in fact, but the Washington Post, I believe it was in 2015, did an investigation and reported on the fact that the FBI was underreporting by more than 50% the number of people who died while in the custody of police enforcement. So there have been several agencies that have tasked themselves to try to monitor that. And so one of them is the Washington Post. They have a database that is that tracks the number of people who are killed by shooting by police officers who are on duty. So it's very specific. And then Mapping Violence tracks the number of people who are killed by police while in police custody. So not just limited to shooting or while on duty. Now, the challenge about the reporting in our country is that there's a volitional component of when the different police agencies might offer the information. There are some federal mandates, but we still can't seem to have an accurate reporting system. And that allows for there to be quite a degree of potential underestimation of what's actually going on. That's one thing for you to consider. The other thing that I want you to consider is that if there is a death in while someone is in police custody and there was no publication of it, the media wasn't there and no one had their cell phone, there's no way to know what actually happened unless it was reported. And as we know, the people who tell the story, the ones who are surviving, may not always tell the truth if history goes the way that we're taught with about American history in this country. So we don't have an adequate reporting system that is comprehensive, and we don't have protocols across the reporting systems. And we also need to consider that these numbers are specific to the killings by police. But what about the non-fatal shootings? What about the beatings of African-American people? What about the choking deaths or other suspicious deaths while in the custody of law enforcement? We don't have ways of capturing that consistently, and we need that information to better understand just how significant I submit racism is as a pandemic, but certainly as a public health issue. So to interpret this graph from, or this slide from Mapping Violence, the orange bodies that you see, that's the 98.3% of killings by police who have not, so these are officers who have not been charged with a crime. And then the light blue that you see on the bottom, that's the percentage of people who have been charged with a crime, number of officers charged with a crime. And then the darker colored individuals in the lower right-hand corner, that's the percentage of people who are actually convicted of a crime. So when you see statistics like this, where 98.3% of the killings by police don't result in charges, it seems as if there's no remedy. It seems as if there's no accountability. And that reinforces that subcultural sustress that I believe exists in the Black community that tells us that Black bodies are not safe with American institutions. It tells us that we are not able to trust those that are meant to protect us. And so that is why Black lives matter. And I hope for people who really struggle to understand why it's not all lives matter versus Black lives matter, that statistics like this will offer you more information as to why it's important to qualify that Black lives matter. Next slide, please. So again, please keep in context where these numbers are coming from. So almost 25% of people who are killed in America by police have a known mental illness. And that increased the risk factor of something like a factor of 16 if you have severe mental illness and a police encounter of being killed. So more than 95% of people shot and killed by police are males, and more than 50% of the victims are between 20 to 40 years old. So we are losing people in the prime of their life. And this is also why I submit to you that racism is a public health issue, because with those lives lost, then they're not able to contribute to our society. And if they're not able to realize their potential and contribute to our society, and if their death is causing more physical and mental health distress, which is contributing to the shortening of life and the quality of life of African Americans, then our society as a whole is losing. Next slide, please. So the two databases that I mentioned, that of the Washington Post and that of the Mapping Violence, much of their information is consistent in that police kill approximately 1,000 people per year in the United States. Of that, more than 300 are Black Americans, and at least a quarter of them are unarmed. Next slide, please. So 13.4% of our population is Black, but 28% of those killed by police, Black people in the United States. So a Black person is more than 2 times more likely to be killed by police than a white person. And it's important, again, to remember that to the best of our ability, these numbers are underreporting the reality. And then a Black person is 1.3 times more likely to be unarmed when killed by police compared to a white person. Next slide, please. Again, so this particular video is one that was, it actually is an 11-year-old who wrote a speech, and she was tasked to actually make it into this video, which is something that if you've seen before, again, I hope that you will try to learn something more from it this time around.
My skin is not a threat. It's funny how the world has different time zones. How it could be Saturday on this side of the world and Friday somewhere else. Yet somehow the United States of America is stuck in 1920. That was 100 years ago. Yet we're still fighting for our lives, for a place here. What did we ever do to make them hate us so much? I know for a fact they love our culture. They love to steal our braids, the way we talk, anything we call ours. But when it's that one white bad cop and that one innocent black person, that black person fears for their life. This is the world we live in. See, when I was younger, teachers used to ask kids what they wanted to be when they grew up. Some kids said famous. I was one of those kids. But now I changed my answer. The thing I want to be when I grow up is alive. How do I know that I'm gonna make it out alive if I'm suspicious doing nothing? If I'm suspicious when I'm at my own house, sleeping in my own bed? Why am I suspicious? Because I could have sworn from 1 to 3 I was the cutest thing. But when did I stop being cute and start being scary? Am I scary if I have a black hoodie? Am I scary if I wear a backpack? Am I scary if I do nothing? Am I scary? Does my dad scare you? Does my mom scare you? Does my auntie scare you? Because let me tell you something. We are not scary. Ahmaud Arbery, Breonna Taylor, George Floyd, Tamir Rice, Dontre Hill, Michael Brown, Eric Garner, John Crawford, Ezell Ford, Walter Scott, Kai Gert, Stephen DeMarco Taylor, Tony Robbins, Miles Hall, Jamie Johnson, Antoine Rose, Stephon Clark, Jacob Blake. Say their names. You will earn my respect when I don't have to fear for my life or anybody else's. Until then, my respect will not come for free. Black Lives Matter.
So what I will offer regarding this particular video is not just that it comes from a child, but this child changed her dream from being famous, or a child might change their dream from becoming the next nuclear physicist to just wanting to live and not be shot for no reason if they're Black. And that means that there really has been a significant impact upon the mental well-being of African Americans. So let's talk a little bit more about research. So Dr. Eng did a study, and he assessed 700,000 high school students in large urban areas to try to capture the potential impact of the local police shootings. And what he found is that there are significant educational impacts as well as mental health impacts, and that the harmful educational impacts are limited to Black and Latinx students. So he was actually able to extrapolate data that indicates that for every killing, a police killing, 3 students of color would drop out of school. He also showed that the impact wasn't just immediate, but it actually also showed that over time, for multiple semesters, there was a lower academic performance, which again contributes to the understanding that the stress from racism or perceived discrimination, or the microaggression that visualizing Black deaths at the hands of police can cause on young people is chronic and will have chronic consequences. Next slide, please. So this is what I consider a landmark study regarding the relationship between police brutality and Black mental health. Essentially, what it shows is that there's no effect on the mental health of white Americans when police kill white Americans unarmed, but there is an impact on African Americans, not when police kill armed Black Americans, but when police kill unarmed African Americans. And you'll notice I'm using African Americans and Black Americans interchangeably. So again, the study showed that there's a particular correlation between the publicized death of unarmed Black Americans and the mental health of Black Americans. And that results in an increase in poor mental health days. Next slide, please. The equivalent of which is almost 2 days per person per year, which amounts to 55 million excess poor mental health days per year in the African American community, just from being exposed to police, the incidences of police brutality that are not necessarily directly related. Next slide, please. So let's talk a little bit about what we can do and some protective factors. So if someone has a good social support, meaning they're well connected to their community, their family, have religious supports, then I think then that helps actually for them to manage the impact of racism, perceived discrimination, and microaggressions. The coping style that one has, being able to be adaptive in their environment, particularly in the midst of stress, is actually a protective factor. Having a very good sense of your racial and ethnic identity is actually protective. And then having certain personality variables that allow you to connect to others, and also that will allow you to prioritize things like self-care and to be self-aware or mindful are things that are moderating factors that help to protect us from the harmful impacts of racism. Next slide, please. So the APA is aware that chronic emotional stress is causing negative physical and mental health effects on African Americans. And this is my part of the call to try to see, to increase awareness, and then for us to see what it is that we can do to try to address the ills of racism in our society, because they affect our mental health. And for those of us who are mental health practitioners, it's a way for us to become more culturally competent. And for those of us who are consumers or community members, it's a way for us to be more compassionate to one another. Next slide, please. So I'm heading back to the approach that I told you about, which is that if we can't talk about it, we can't change it, we can't solve it. Like Dr. Beverly Tatum reported, and she has several books that are helpful in trying to encourage healthy and constructive communication around race, particularly for younger people. Next slide, please. So the pathway is the approach. We need to be able to talk about it. We need to be able to think about it. We need to be able to take action so that things can change. Next slide, please. So talking about change, the American Psychiatric Association actually issued an apology where they acknowledged that their early practices set the groundwork for inequities in that system, in that institution. They didn't just offer the apology, they offered a plan that they have to try to start to address some of those inequities. And that's encouraging. Next slide, please. So we have a very big task before us. It is not easy to discuss race. It is not easy to unlearn the things that we may have learned that might be preventing us from being, from realizing our full potential and having the highest level of mental health, or helping to make mental health treatment more equitable for everyone in our society. So we need to teach ourselves. We need to be able to learn, and we need to be able to be open to growing. We need to encourage diverse and more comprehensive research, particularly in the areas of mental health and the relationship between racism, perceived discrimination, and even police brutality on African American health. And again, not just at the level of fatal shootings, but other ways in which the interactions affect one's African Americans' ability to thrive in their communities. And then we really need to understand better how we can be advocates. Next slide, please. I'll give you a moment to review this slide. And as you're reviewing it, what I will tell you or share with you is that I included this slide because I think it does a really good job of a number of things. It really emphasizes that we have to know the truth and we have to tell the truth. We need to accept the truth, hold ourselves accountable on both sides of the conversation, understand that that racism is this entity that has been there since slavery, through Jim Crow, through separate but still unequal. And it's something that we are actively dealing with now, but it is something that we can work together to improve. And it's not a white issue. It's not a Black issue. It's an American issue. It's a human race issue. Next slide, please. I want to encourage you to continue your consciousness journey. As I said, there are some things that are difficult to talk about. Race is one of them. Be prepared to learn and unlearn. Become intentionally anti-racist. So by definition, anti-racist is someone who is not just not a racist, but they actively try to address the ills that racism causes. Become an ally. Again, there's activism in that term ally. Not just not being a racist, but being willing to speak up and to try to learn and to educate. Those are the things that will help us to be able to progress forward as individuals, as practitioners, as consumers, as community members, as members of the human race. Next slide, please. So I really appreciate the time that you all have shared. I hope that you have been able to learn more about the role of racism, perceived discrimination, microaggressions, microtrauma, and its impact on African-American health. I want to encourage you to do what you can to stay woke. And at this time, I will thank you so much for your participation and ask if you have any questions.
Thank you so much, Dr. Peterson, for that presentation. Yeah, definitely share the references. So this is going to be a little bit complicated because there's a lot going on, and there's been a lot going on over the course of the presentation. Please put any questions that you have in the Q&A section, and we'll do our best to get to them. We're going to also accept questions from YouTube, and we'll do our best to get to those. Dr. Peterson, you were busy giving your piece, so I just want to bring it to your attention that believe it or not, during the presentation, as you're presenting on microaggressions and talking about the systematic mental impact on Black lives from Black violence, someone in the chat, of course, raised the issue of Blue Lives, saying they came from a blue family, they come from a police family, and et cetera, et cetera. Now, what I want to say to folks is, for people who are frustrated with the chat right now, please understand that part of the problem is that some of you are just responding to panelists and not responding to panelists. And so the conversation you're seeing is disjointed. It's not, everyone's not seeing all the responses. But the person who raised the issue of Blue Lives Matter was responded to by a number of different people. Many people feel like this was a distraction from the conversation. And I will say to you all, a famous writer by the name of Toni Morrison said that the greatest thing that racism does is that it distracts us from the work that has to be done. So I didn't want to interrupt you, Dr. Peterson, to raise that. But obviously you spoke about this a little bit in the presentation, and I just want you to speak about it a little bit here so that, again, there's a lot of folks who are upset in the chat right now. They're upset because they feel like this person hijacked this presentation, distracted from your incredible work. And actually they couldn't see, not everyone's able to see all the conversations because people are not responding to everything. So I don't even know if you want to address the Blue Lives Matter comment. I just want to make you aware of that. So folks know that we're pretty used to dealing with this kind of stuff in this environment.
So let's go back to the dynamism and the definition of racism, right? Where I think we do a really good job of understanding, or at least acknowledging, the disadvantages to Black people, but we really don't understand the challenges that are associated with white supremacy and entitlement, and understanding the benefits of structural racism in our society. And it's because of that that I think we need to be patient and we need to have open ears and try to listen to what is really being said and to stay focused. Like our Uncle Mac used to tell us, stay focused. And so the point of this presentation is really not about whether or not all lives matter, blue, brown, red, any color of person's lives matter. The actual point of Black Lives Matter is really to try to bring attention to the fact that racism is a crippling problem in the African American community, and it is one that is affecting our mental health and our physical health, and that is not meant to cast aspersions on any one individual or even any one entity per se. It's really just information that is factual that many people don't know. And sometimes when people are able to have more information, it empowers them to make better and more healthy decisions and to better realize their potential and to be able to better manage and contribute fruitfully and productively to their community. And so there's a lot of things that I could try to explain about what my personal experience is with, I'll say Blue Lives Matter versus Black Lives Matter. But that example to me is akin to the microaggression where someone tries to qualify that they're not racist by saying that they have a Black friend. It misses the point of the information that was shared. And so I would certainly be willing to try to have hopefully an honest and constructive conversation to understand where that person is coming from and to be able to address their concerns, because the point of Black Lives Matter is not to attack the police or law enforcement. It really is.
I think, no, that's an appropriate response, Dr. Peterson. I think maybe the larger issue is, and this is, again, this happens a lot when we present on specific research or specific, want to talk about crime. And I think some of this was already responded to in the chat, but I just want to clear a few things up. There is no such thing as Black on Black crime. Black on Black crime is a media construction. When you look at crime rates across communities, most violent crime is committed intra-racially. So it's essentially neighbor to neighbor violence. Not necessarily, like, you don't hear about Asian on Asian crime or white on white crime, right? You hear people talk about a lot, but that's a media construction. All violent crime, the large percentage of it is committed intra-racially. So I just want to set that aside. But Dr. Peterson, maybe you can talk to the participants a little bit about the trauma kind of violence within certain communities. And again, that's not what this webinar was about. But folks want to bring up certain issues or are inspired to think about certain issues based upon the content of the data you're presenting in the webinar.
So please rephrase the question, because you went out, your voice froze for a moment. I'm sorry.
So the question is, I just want, first of all, I want to make sure everyone heard me clear up the fact that Black on Black crime is a media construction. Mm-hmm. The preponderance of violent crime is committed neighbor to neighbor intra-racially. And just so you all know the relationship between the research that Dr. Peterson presents today and the kind of crime that occurs in communities that are predominantly Black, when we're talking about systemic racism, when you're talking about police as arbiters and representatives of this devaluing Black life, that does have a direct impact on the Black. And so there's a relationship. But I think some folks believe that if we're talking about police brutality, we don't talk enough about the kind of trauma in our community that is intra-racial, if that makes sense. So I wonder if you want to talk a little bit about that, Dr. Peterson.
So I do think that is somewhat outside the scope of this particular talk. And I do think that what it really does is it speaks more to the senses of poverty, not just racism, and how that motivates behavior, and how exposure to some of the consequences of poverty, which are lack of resources, lack of opportunity, lack of expectation, contributes to moral desensitization or a decrease in morality. And there are some studies that support that really can change the way that people relate to one another and change what seems to be, or I'll say, acceptable behaviors in response to stressors.
That's very good. We're going to move along here. What do you say and how do you teach about microaggressions, like what you taught us about today, to people who consistently try to negate what you're trying to tell them about discrimination? So how do you teach folks about this information for people who are super resistant? That's an anonymous question.
Sure. I'm actually not as invested in trying to change someone's mind as I am in trying to share information. There are plenty of people who are truly willing to learn and really want to do what they can to make a difference, to improve, to grow. And I think it's important to try to partner with those people who are available. Everybody's not always available, and sometimes that's okay. And so I really feel like it's important for people to feel like they can express themselves, but it's important for us to stay focused. And our goal is to try to make sure that we share our passion and our commitment to our belief that education empowers and liberates. And so, and I think that we need to be able to identify racism as the public health issue that it is. And if we have more information, then we're going to be able to challenge it and hopefully eradicate it in our society, if not this generation, the next generation. And again, I want to acknowledge that it is very difficult to talk about race. There are, all of us have the potential to internalize racism and have the potential to not really understand the role that systemic and structural racism actually play in our lives, in our perceptions, in our perspectives. And so this is a topic that is triggering. It sounds like from what you shared that some people were triggered. And I just want to encourage us all to be mindful and to agree to disagree if that's what's necessary, so that we're able to take what we can from this experience, from the information that was shared, and hopefully become better and more able to realize our potential going forward.
Mark, I'm getting ready to throw to you, but I want to ask one more question here of Dr. Peterson before we try to get some questions from YouTube. This is a two-parter. Number one, can you talk a little bit about your decision in the presentation to just show the microaggressions and not necessarily discuss them? Why do you think, what was that strategy? And I think the second piece of that is the reading of the names, because I think the most powerful point from my perspective today was the reading of the names and the quiet that it brought in the chat and to the presentation itself, but also people adding names to that list in the chat. And so can you talk about those two decisions in terms of, like, again, how you're educating us? What was the decision about having the microaggressions there, your own personal microaggressions, but not really commenting on them? And then the reading of the names of those lost to police brutality.
So thank you. So I meant to close with that. So I don't know about you all, and I'm talking about the community of participants, but I was distracted, right? Those random slides coming up were a little bit distracting and had the potential to take me off message, off task. And I really wanted to be able to share that reality with you. Those are all comments that I have heard in my life, where I was a little bit less informed and less equipped to be able to adequately address them. But they are examples of my personal experience of microaggressions. And I wanted to be able to share them in such a way that you all may have an idea of what it might take for an individual who experiences microaggressions to still do what they have to do to get the job done. Because ultimately that's what we're tasked to do. But it doesn't mean that we should not address them when it is appropriate. And it was appropriate at the end of the presentation to know what people thought about it, how they experienced, sort of seeing those statements, if that encouraged them to consider how it is that they use language to communicate some of their thoughts. So really just, again, the information that is shared is supposed to be thought-provoking, because remember, our approach is talk about it, think about it, take action, and then we'll transform. And secondly, I think that sometimes people do not understand the the significance and the impact of the loss of life that we're experiencing that's affecting not just our community, but our nation. And so I believe that when opportunities present themselves to appropriately say their names and to understand how for whom the bell tolls, it tolls for all of us is a shared experience. And it should encourage us to want to become more enlightened about how to be better and do better.
Mm-hmm. Emily says, thank you for this excellent and profound presentation. I was wondering, can you give us some practical tips on how we can acknowledge microaggressions, and try to correct ourselves when we notice ourselves doing it?
So remember that race is a sensitive topic to discuss, and part of the definition of microaggressions, the person who's actually offering the insult may not actually know it, and they might end up feeling like the person is oversensitive if they identify it. And if you happen to notice that someone else is offering a microaggression, that could still trigger that person, even if you're not the person the microaggression is directed towards. And if you're the person who offered the microaggression, even if it wasn't intentional, there's still a hurt involved. So the person who receives the microaggression may not be in a position to process with you at that particular time. So talking about race takes planning, patience, and truly a willingness to unlearn and learn, and to know that everybody's not always where you are in terms of being able to have an exchange. And so it's important to be mindful of whether or not there's an appropriate, if it's appropriate to try to address it. But I think curiosity expressed in a constructive way, allowing for the fact or announcing the fact that there's genuinely not malintent involved, can be a good way to start a conversation, as long as there's the opportunity for the time to have the conversation and a willingness for it to be more than just an instant of communication. It needs to be a process of communication.
Mm-hmm. Now, just to be clear, that works with someone you know. If you're asking about that hair, that might not work with someone you don't know if you try to touch their hair.
Well, but again, so right. So if your microaggression is actually an action, if it's a micro assault, literally that could lead to danger. So it's really important to respect people's boundaries.
Mm-hmm, mm-hmm. Connie asks, how do we encourage people of color to get help, and how do we advocate for ourselves in our own healthcare?
So that's where it's important to really understand the role of internalized stigma as well as structural stigma. So in the African American community and in other communities of color, there's still this delegitimization of mental health as the equivalent of a somatic or a physical health symptom. There's this disagreement over whether or not health totally actually includes mental health. And of course, we submit that you cannot be healthy if you don't have good mental health. And so being able to explain to people the 8 dimensions of health, according to the 8 dimensions of health, or being able to explain that there's no significant difference between someone being treated for high blood pressure or diabetes as there is for someone being treated for depression or anxiety, that they are all related to structural components of our physical body, I think might go a long way towards people feeling a little bit more comfortable with accessing help. And also starting from a young age, giving ourselves permission to actually engage in self-care is something that I think will change the dynamics of the African American community going forward. We'll really be able to challenge the concepts of John Henryism and the strong Black woman syndrome.
Mm-hmm, mm-hmm. Sarah asks, and this might be our last question because I want to make sure we have time for any kind of closeout and house cleaning that we need to do. Sarah asks, as a white person working as a peer support specialist, how can I use this information to not only avoid my own missteps and hold others accountable for racism, but to support peers of color and validate them without white-splaining? And she put white-splaining in quotes.
So this is just a little bit of information. So I would encourage you to keep trying to learn, and then invite people to partner with you in learning, right? So there are things that you might be able to teach about race, and there are things that you might be able to receive, and vice versa. Again, we need to avoid the idea that any individual Black person is a specialist on racism or the Black experience, or any one white person is, especially some white supremacy or the white experience, really need to try to take baby steps and just try to be open, sensitive, and aware.
Mm-hmm. Dr. Peterson, thank you so much for this presentation, and thank you everybody for tuning in. I just want to make sure that I also thank everybody at PA Cares. Mark, Jamal, and Nancy have all been extraordinary in making this happen. And I really do appreciate all the voices. I know folks get upset and chat and stuff like that, but Dr. Peterson and I, we appreciate the engagement. Like, we want to see people engage. I think I wish we had more time, and we do hope that we have more opportunities to engage the community about this important research. But I want to turn it over to our partners to make sure that we don't go over time too much. I know we got about a minute left. Mark, Nancy, and Jamal, thank you guys so much for everything.
Thank you.
All right. Well, thank you all for attending today. Let me just go over a couple of cleanup pieces here. Let me just, we'll just do this real quick. Okay. So thank you, Dr. Peterson, for this presentation and for speaking about the importance really around the lines of communication and understanding each other, and really while ultimately being culturally sensitive. Remember, for those seeking continuing education credits, please make sure you use the link in the email that you received today, and that will take you to the UPMC address, the issuer of the credits. You must have registered prior to the webinar to get the continuing education credits. You'll also be prompted after today's meeting and through an email tomorrow to participate in a brief survey about this presentation. This is separate from the CEUs or CECs. Your feedback is important to us, and this survey will also allow those individuals requiring certificates of attendance, not the continuing education credits, to provide an email so that we can send you the certificate, especially important for those attending through YouTube. Our next presentation will be on March 11th of 2021, starting at 2:30 p.m. Eastern Standard Time. The Power of Simple Interactions, Understanding and Promoting Everyday Human Interactions, presented by Dr. Dana Winters, Director of Simple Interactions and Academic Programs Assistant Professor of Child and Family Studies at the Fred Rogers Center. We look forward to seeing you again. And I must say, and thank you to our team at the PA Care Partnership for all the hard work that you've put into this, and a big thank you to Dr. Eunice Peterson and Dr. James Peterson. Thank you all, and everyone just have a fantastic day.
Thank you.
If you're interested in contacting the Petersons, if you'd like to have them come and speak with you, I just put my email in the chat. I'll put it in again, and get in touch with me, and I'll get the information to them. And I also would just wanted to say that I was so deeply moved by today's talk, with the grace to have been here and to be a part of it, and to experience the frustrations and the angers, as well as the love and the caring. And I personally and sincerely thank you for all your important work.
Thank you all. Have a fantastic day.
Thank you.